Hello, everybody. The discussion is on the managing of patients with the end-stage disease. Here we'll be discussing on the renal disease, which is about the last stage of the chronic kidney disease, and the end-of-life care includes the focus on the caregiver's experiences with the unique challenges of the daily care that includes the range of distress and conflicting emotions. The patients and the caregiver needs includes the guidelines of different symptoms and care. The life limiting illness is about the curative care options where there are multiple trips of the emergency rooms. Not only this, the last stage care includes the practical care and assistance, comfort and dignity. Stages for curative actions includes the stages that are for multiple trips to the emergency room, admission to the hospital, wishing to remain at home, deciding to stop treatment for the disease, the focus is on the palliative care measures to control the pain and the symptoms like constipation, nausea, and the shortness of the breath. The care and the placement options are the identification, assessment, and the death, where we need to discuss on the high mortality risk, difficulty with the EOL decision making, advanced care planning, suffering of physical symptom management, and bereavement support for loved ones. The hospice and the palliative care includes the expectancy, which involves the final days to handle the higher quality of life. The care for the terminally ill family is about will they be able to accommodate to the hospital bed? Are there transportation services available? Is professional medical help accessible for routine and emergency cares? Are you able to lift, turn, and move your loved ones? Common symptoms in the end life care are provided below, like the drowsiness, unresponsiveness, confusion about the time, loss of appetite, the decision perceptions and the characteristics are important for comforting emotionally with support and resources and personal or clinical characteristics. There are there are factors where one cannot speak or smile, and one needs to stay calm and attentive to create a soothing atmosphere with communicating sensory experiences. The contact with the pets or trained therapy animals can bring pleasure and ease transitions. Allow the loved ones to express the fears of death, allowing them to reminisce, avoiding withholding difficult information, honoring wishes, respecting the patient's needs for privacy. Coping up with the grief and the loss includes the diagnosis with the terminal illness and the caregiver's life. There are diseases like Alzheimer's or cancers which can give you and your family the gift of preparing for and finding meaning with your loved ones who end the life. Caring yourself and managing pain is important with joining the support groups and using the timers, reminders for regular medicines. The reconnection and usage of the loss. The reconnect is about the potential complications which affects the body. Keeping the journal and talking to the therapist is important for finding the new relationships and meaning with earned health and happiness. There are different factors which would be evidently seen when a person is at the end of the life, and so the end of life care includes the need that can change with the practical care and assistance.